The information and exercises demonstrated on this program are for general informational purposes only and not intended as a substitute for professional medical advice, diagnosis, or treatment. Before starting any new exercise program, including yoga, it's important to consult with a qualified healthcare provider.
Hi, I'm Dr. Ashley Mann, and I would like to welcome you to Breathe Yoga and Wellness. Today's topic will be low back pain because low back pain is the number one musculoskeletal complaint that most people have when they visit a chiropractor and sometimes even a medical doctor. So first, I want to just talk to you a little bit about the anatomy of the spine and talk to you about what the low back is versus your SI joint versus your hip. So let's talk about what your spine looks like. So this is the base of your skull, your occiput, and from there you have 7 cervical vertebrae, 12 thoracic vertebrae, and then you have 5 lumbar vertebrae. So the 5 lumbar vertebrae and the hips and the SI joints are where we're going to focus today. So here's your lumbar spine. Most people think this is the hip, so they point here to a hip pain. This is actually where your ilium, part of your pelvis, meets your SI joint and to the sacrum. The hip is actually this joint here, this is the top of your leg bone, known as the femur. The ball of that inserts into what's known as the acetabulum. So we're going to focus on SI joint and lumbar spine today. So with the anatomy of the spine, the lumbar spine, we have muscles that support the spine. They're called your paraspinal muscles. And typically they can be very tight, especially if you experience low back pain, you work at a desk, you're seated often. And tight does not always mean strong. So we're going to talk a little bit about what that means as well. The SI joint, you see this big nerve here. This is actually your sciatic nerve. And so your piriformis muscle often sits on top of that nerve, and some people experience sciatic pain, which is like numbness and tingling down the leg. This can happen if this muscle is tight, known as piriformis syndrome, or if we have nerve root involvement from the lumbar spine. Now, if we turn around and we look at the spine from the front view, so this would be like at the front of my body, you see the vertebral bodies here, and you see this big muscle here. This is your psoas muscle. Your psoas muscle is connected to your lumbar vertebral bodies, and then this muscle comes down into the front of the body and turns into your iliopsoas. So if you put your hand kind of in the crevice of your hip and you lift the leg, you can kind of feel what's known as your hip flexors. That muscle can get tight from being seated often. So people that drive a vehicle often for work, truck drivers, or if you work in an office, sometimes this can be quite tight. And this can pull on the low back and create low back pain. Also, these in between each vertebral bodies, you see discs, and our discs are made of 2 components. We have the annular fibrosis on the outside, which is like the hard part of the disc, and inside of that is the nucleus pulposus, so it's like a jelly donut. And so to keep our jelly donut full, we want to stay hydrated. We want to create movement in the spine to nourish our spine. And then sometimes we have complications with that area, such as a bulging disc. So if you see this is the bulging disc, and a bulging disc just means that the disc has protruded out farther than the vertebral body by 25%. So if you have your disc here and your jelly donut should be the same size, that jelly donut gets a little bigger, and it's about 25% bigger than the disc. Then we have disc herniation, and that's what you see here to the side. This is where the center of the jelly donut kind of protrudes out, and it can cause a lot of pain for people. So bulging disc versus herniated disc, healthy disc. So let's talk about a few things that we can do to support our lumbar spine, since low back pain is a common complaint for many people. One of the things we want to do for our tight muscles is lengthen those muscles. So we want to stretch, do yoga, And then we want to strengthen the areas of the body that they are supporting. So if we have tight muscles in the low back, it typically means that those muscles are staying strong and tight so that they support the spine where there's things going on. So we need to loosen those up and then strengthen the muscles around, which are typically like our pelvic floor, our deep core muscles, often our glute muscles, to support the muscles of the low back. So if you stay seated a lot for your job or for what you do during the day, it's important to stretch hip flexors, psoas muscle, and the muscles of the low back. And you can do this even from sitting and doing some cat-cow to get some flexion and extension in the spine, some rotation, and then some lateral bending. And you can follow one of the yoga practices to find out how to lengthen the muscles of the low back. So we want to move our spine in all 6 directions. And then we want to work on things like pelvic tilts, bridge ups, squats, to strengthen the pelvic floor, the deep core, and the glute muscles. So if you experience low back pain, you can stay tuned for a couple different yoga practices, one to lengthen the low back, stretch the low back and the hips, or one to strengthen the low back, the pelvic floor, and the glutes. If you experience low back pain that's to the point that it's interfering with your daily life, if that's a good time to potentially see a medical professional, a physical therapist, or a chiropractor to help you with your low back needs. I'm Dr. Ashley Mann, and I would like to welcome you to Breathe Yoga and Wellness. For today's practice, we are going to focus on the low back and hips. We are going to lengthen the muscles that are typically tight in the low back and hips and strengthen the muscles that will support the lumbar spine. So go ahead and find your way into a child's pose with me. Big toes touching, knees apart. Sit back on your heels and walk your hands forward, letting your forehead rest on the earth. And then once you get there, you can kind of rock side to side, make any adjustments that you need to let your body rest, letting go of any effort, energy you're using to hold your body up. And just take a moment to notice the low back as you're here in this child's pose. Notice if it feels tight there. And from here, I want you to just begin to connect to your breath. Inhaling through the nose. Let's take a cleansing breath and exhale through the mouth. 2 more just like that. Inhaling through the nose. Big sigh, let it all go. 1 more breath. Exhale, letting go. Now from here, begin to breathe in and out of the nose if that's available to you. Making breath with sound if you know how. Ujjayi breath and sound as you breathe in and ah sound as you breathe out. But the lips are lightly closed, little space between the teeth. And as you start to deepen the breath, just imagine that your lungs are balloons and you start to fill the balloon at the top and you're working towards reaching all the way to the bottom, so that the body begins to expand in all directions, feeling the backs expand towards the sky, and really focus on trying to get your breath down into the low back, into the pelvic floor and the front of your belly here. Each round of breath making a little longer, a little deeper than the last. Couple more rounds of breath here. And then as you're ready, we're going to slowly walk our hands over to the right, extending out through that left side body, reaching our fingertips away from us, feeling a yummy stretch all the way up the side, into the lats, maybe even into the armpit, all the way up to the pinky finger. Letting that pull happen all the way from the hip, breathing.
If you feel like you need a little bit more here, you can take that left hand, place it on top of the right, and get a little bit extra stretch there. If you go there and it's too much, just take your hand back to where it was before. Staying connected to the breath. And then slowly make your way back to center and start to walk your hands all the way over to the left, reaching the fingertips away from the body. And notice which side feels tighter than the other. One side will, and that's normal. And then maybe you take that hand and place it on top of the left hand, breathing. Really extending out through that side body. And then slowly walk your way back to center. Once you get there, just place your hands wherever you feel comfortable, keeping the shoulders relaxed. And we're just going to rock the hips back and forth. So imagine taking your right hip and rocking it towards your left inner thigh, and then the left hip rocking towards the right inner thigh. Just noticing that connective tissue around the hip socket itself. Noticing if that pulls into the glutes or the low back. Staying connected to the breath. And then the next time you press your left inner thigh, your left hip to your right inner thigh, hold. Let's take a breath here. Slowly releasing that, and then opposite direction. When you get into that point of tightness, take a breath there. And then slowly release. Draw your hands underneath your shoulders. Press yourself up to tabletop position. Hands under shoulders, knees under hips. Look back in the space you've created with the legs. Scoot the feet where you can't see them. Durga Go or Cat Cow. Begin to inhale, letting your belly fall towards the floor, making a smile with your back. And as you exhale, round out through the spine, pressing your hands into the earth like a mad cat, tucking the pelvis, navel to spine. And let's take about 3 more of those on your own breath. Only going into a back bend that feels good to you, and then really pressing out, extending, pulling the spine up towards the sky. The next time we come back to center, we'll hold. From here, press the weight of the body in the tops of the feet, and then we're going to make some big circles through the body. Feel free to move your hands if you need to here. You might notice a little clicking and popping, but we're just getting some synovial fluid moving in the shoulders and the hips, both of our ball and socket joints. Now, if you need to, you can kind of find a place that needs a little extra love and rock into that if you need that. We're going to take about 3 more rounds of breath here. Just make sure as you're pressing forward, we're not pressing into the kneecaps. Press into the tops of the feet, and then press into the finger pads as well, so you're not putting too much weight into the wrist. Next time you get to center, change the direction of your circles. Notice which side feels tighter than the other. Try to stay connected to your breath as you're rotating. Again, if you find a little spot that needs a little extra love, you can make some tiny little movements there. A couple more rounds of breath. You should start to feel those joints feeling a little bit looser. And then we're coming back to center again. Draw the hands under the shoulders if you moved your hands. Big starfish hands. Adho Mukha Shavasana. Curl the toes under for downward facing dog, lifting the pelvis up and back towards the wall and ceiling behind you. And then let's just pedal down the feet, bending one knee, pressing through the opposite heel, breathing, noticing how you have tension in the posterior chain or if it feels good today. Really pressing your chest toward your toes, breathing. If you need to bounce up and down, feel free to do so. If it feels good to you to rock onto the sides of the feet, feel free to do that as well. Just kind of listening to your body and what it needs today. One more round of breath here. And on your next exhale, bend your knees quite a lot. Look forward, step forward to meet your hands so that you're in a forward fold. Let your body hang like a rag doll. Maybe bend the elbows. Let your body sway side to side if that feels good to you. If it feels good, take your hands behind your back, interlace your fingers, and let your fists fall forward. Maybe make a circle with your head clockwise, counterclockwise. Shake your head yes to listening to your body. Shake your head no to pushing past your point of tension. And then take a big breath in. Exhale, side out. And as you feel ready, release the hands. And then we're going to roll up one vertebrae at a time. As you do this, press into your heels, engage the core. Let your head be the last thing that stacks on your shoulders. And then when you get to the top, shrug your shoulders up, roll them down and back. Turn your palms forward and maybe rock forward and backward onto your feet, moving into Tadasana or mountain pose, lifting up through the crown of the head, breathing, just taking a moment here to be present. And as you're here, take a moment to set an intention for your practice today. Now from here, we're going to engage the core or the bandhas. So what I want you to think about doing is pulling up from the pelvic floor. So like you're going to put on your tightest pair of pants, everything kind of pulls into the center. Now imagine I have a string around your belly button and I'm pulling that straight back. So you should almost feel your hips and ribs come towards one another. As you do this, if you feel like you need to drop your chin to your chest, you may do that. Shoulders are relaxed, reach the fingers to the floor, pulling up and back and then up towards the heart. Everything's nice and tight. Engaging through the core here. Breathing. You should feel like your entire body is working. You may start to shake a little bit. That's okay. Breathe. Tiny little breaths if you need to into the chest to keep all this locked in. We're going to do this for a couple more rounds of breath. One more breath here. And now release. Feel the difference in your body. So engaging in core work and doing abdominal work are two different things. So that's what it should feel like when you do your core work today. From here, we're going to move into some half sun salutations. Inhale, reach the hands up. Exhale, leading with your heart center, hinging into the hips, bending your knees as much as you need to support your lower back. Inhale, halfway lengthen the spine. Body makes an L shape. If you need to, place your hands on your shins or your thighs, really lengthen through the spine. Feel that yummy stretch in the posterior chain and the hamstrings, which are often tight and can contribute to low back pain. As you're ready, exhale, forward fold. Inhale, press through the heels, come all the way up. And exhale, hands to heart center. If you're still tight, feel free to widen your feet or put a bigger bend in your knees. Inhale, reach up. Exhale, Uttanasana, forward fold, flat back, hinging into the hips. Inhale, halfway lengthen. Exhale, fold. Inhale, reverse swan dive. Inhale all the way up. Maybe take a little bit of a back bend if that feels good to you. Exhale, hands to heart center. Inhale, reach up. Exhale, leading with the heart, hinging into the hips. You should start to feel that posterior chain start to warm up, loosen up. Inhale, lengthen, belly is strong, shoulders down and back. Exhale, forward fold. And reverse swan dive. Inhale all the way up. And exhale your hands to your heart. We're going to take a twisting forward fold here, so feel free to widen the feet a little bit if you need to. Little bend in the knees. Inhale, reach up. Exhale, Uttanasana, forward fold. Inhale, lengthen. As you exhale, place your left hand on the earth, bend the left knee, and then reach that right hand to the sky. Stacking the shoulders to the best of your ability. Pull that right hip back behind you, lengthen through the crown of the head. You should feel a stretch from the hip all the way down the back of the leg. One more breath here. As you exhale, start to bend that right knee, place the right hand on the earth, and then reach that left hand to the sky, pulling the left hip back behind you, pulling the crown of the head forward, twisting between the ribs and the pelvis.
Try not to put too much weight in that supporting hand. Staying connected to the breath. And as you're ready, exhale, forward fold. Walk your feet into about hips distance. Inhale, lengthen the spine. Exhale down, plant the hands, step back to plank position, top of a push-up. Everyone drops to the knees here, knees behind the hips, untuck the toes. And we're gonna exhale, lower all the way down to the floor. Elbows are snug to the body. As you inhale, scoop up, low cobra. Shoulders are down and back. You should feel your glutes engaged. Tops of the feet are pressing into the floor. And then exhale down. So we're going to do that about 5 more times. Take a breath in. Exhale, low cobra. So using the back muscles, engaging, pulling the shoulder blades together, and exhaling down. Again, inhale. Exhale, cobra. Try to keep your hands light, maybe even lift the hands if you can. And then exhale down. 2 more reps just like that. Inhale. Exhale, lift. Keeping that core nice and strong so we're not putting pressure in the low back. Glutes are engaged. Tops of the feet press into the floor. 1 more breath. And exhale, lift up. Maybe lifting the hands to challenge yourself if you need to. And then exhale, lower down. Press to the knees. Curl the toes under, downward facing dog. Working out any tension down the backs of the legs. Hopefully this time in your down dog, it feels a little bit better. Taking a breath. On your next inhale, lift the right foot up behind you. Bend the knee and then turn the hip open. Maybe making circles with the ankle one direction and then the other. You can look under that right armpit if that feels good to you and more stable. And now make some big circles through that knee. To start and work on the hip. Change the direction of the circles. And then turn that right hip back down. Extend the leg long. Press your chest toward your left toe. Take a breath. And as you exhale, step the right foot forward, dropping the back knee into a low lunge. And from here, we're going to come all the way up, shoulders back. I want you to notice what you're doing with your pelvis. Think of it as a bowl of water. So we're going to pull that right hip back, down, pull it back, and press the left hip forward. Now to challenge yourself here a little bit, go ahead and take your hands up to the sky. Relax your shoulders down and back. You should feel a really yummy stretch here in the hip flexor. And now from here, we're going to move into the psoas. So from here, you can stay here, place your hands on your hips, and then lean into that just a bit if that feels good to you. So you're pressing some weight forward into that front foot, but we're still protecting that knee. It's not going out over the front toe. You should feel that stretch kind of come up a little higher, almost into the belly, but keep the core nice and tight. We're not doing a back bend here. Now, if you need a little bit more in this stretch, you can take your hands, interlace your fingers, place your hands behind your head, pull your shoulder blades together, press into the top of the back foot that's supporting you. Take a breath in, and as you exhale, lift your heart up toward the sky. And so here we move into extension or a little bit of a back bend, just making sure the core is nice and strong. Breathe. Inhale to come up. Exhale, bring your hands to the earth. Curl the back toes under, step the right foot back to meet the left plank position. Now from here, we're going to hold this plank. If you need to take the knees to the earth, please feel free to do so. Shoulders are down and back. And think about your bandhas that we engaged earlier. Pull up from the pelvic floor, navel to spine. Everything's locked in. Taking a breath or two. And as you're ready, lower down. Elbows snug to the body. Inhale, scoop up, low cobra, or if you're feeling it today, you can do high cobra. If you do high cobra, keep the shoulders down and back. Glutes are engaged, belly is strong. Curl the toes under, downward facing dog. Taking a couple rounds of breath here. Inhale, left foot up behind you. Bend the knee, turn the hip open to the side wall. You can look under that left elbow, left armpit if that feels good to you. Start to make circles with the left ankle, then change the direction of the circles. Big circles through the hip,
Don't worry about the direction. We're going to change directions. Do that now. Switch the direction of your circle. And then slowly turn that hip back down. Press your chest toward the right toes, lifting that left leg up. Big breath in. Exhale, step that left foot through. Drop the back heel down. Inhale up to your low lunge. So go to the place you were before, pulling that left hip down, pressing the right hip forward, slightly tucking the pelvis, but not rounding out. So you want to keep a nice strong core, but you're not overextending into the back either. So pay attention to what you're doing there. Take your hands up if that feels good to you, shoulders down and back. You can stay here and lean into the stretch, getting into the psoas. You can take your hands to your hips if that feels good to you, or you can interlace those fingers and place them behind your head, pulling the shoulder blades together. Big breath in. Exhale, pressing the heart forward, shifting some weight into the back foot, engaging the core. Working on that psoas muscle. Inhale to come up. Bring your hands to the earth. Curl the back toes under, lift that knee, step the left foot back to meet the right so you're in plank position. And now from here, lower down Chaturanga Dandasana. Drop to the knees if you need to. Inhale, scoop up, low high cobra. Maybe exhale down this time, press to the knees, curl the toes under, downward facing dog. Pedal through the feet as that feels good to you. Inhale, right foot up behind you. Exhale, step through. This time we're going to come into a high lunge. Inhaling up, pulling that right hip back, left hip forward. If you need to take it down to a low lunge, please feel free to do so. Shoulders are down and back. Take your hands to the sky. So I just want you to pay attention to this front hip, the hip flexors down into the quad. Typically, when we have low back pain, we typically have an anterior tilt of the pelvis, too much extension in the back. So what you'll see is this motion as you're seated or standing. So we want to work on strengthening, pulling forward, and loosening up the front of the body. One more breath here. As you exhale, bring your hands to the earth. Step the right foot back to meet the left. Turn the body open, bringing the left hand to the center, reaching that right hand to the sky. Now, if you need to here, you can drop the bottom knee, you can stack the feet, or you can place that right foot on top of the left. Working on strengthening the obliques and the QLs that support the back. Breathing. Lift up through that hip, really engaging. Eyes on a focal point for balance. One more breath here. And as you exhale, try to slowly bring that hand to the earth, stepping into your plank position. Exhale, lower down with control, elbows snug. Inhale, scooping up, low high cobra. Exhale down, curling the toes under, downward facing dog. On your next inhale, lift the left leg up. Exhale, stepping forward into the lunge. Inhale, rise up, adjust your pelvis, core strong, hands to the sky, and just breathe. And just sink into that place that feels good to you, where you feel that yummy stretch in the front of the hip. One more breath here. And exhale your hands to the earth. Step the left foot back to meet the right plank. Take your right hand to the center of the mat. And then reach that left hand up to the sky. So go to the place you were before, either knee dropped, feet are stacked, or maybe you place that left foot on top of the right. Core is strong, lifting up through the top hip, eyes on a focal point for balance. One more breath. And as you exhale, bring that left hand to the earth. Try to do so slowly. Plank position. Exhale, lower down with control. Inhale, scoop up. Exhale down. Find your way to a child's pose. Shifting the weight back, sitting on the heels, relaxing the hands, giving your wrists a little love from the planks and the side planks, rocking those hips side to side. And then take a big cleansing breath. Big breath in. And exhale, let it all go. And just take a moment here to settle in. Notice how you feel in child's pose now as opposed to the way we started our practice. Maybe giving yourself a little rock side to side if that feels good to you. One more breath here. And then use your hands to walk yourself up, coming into a seated position. So what we're going to do now is a seated forward fold, rolling the thighs in, sitting up nice and tall. Relax your shoulders down and back. So as we sit here in Dandasana or staff pose, I want you to notice what you're doing with your core. If you're rounding out, I want you to lift that heart up, roll the shoulders down and back, flex the feet, and think about the bandhas again. You're pulling up from the pelvic floor, putting on your tightest pair of pants, pulling your navel to your spine. Really focusing on strengthening the core in a seated position. Make sure the head's not leaning forward. You want to pull the ear back over the shoulder. One more breath here. Now inhale, sweep the arms up, big breath in. As you exhale, hinge into the hips, go about halfway to your point of tightness. Shoulders are relaxed, so you want to think about hinging rather than rounding. And then you're just going to take about 5 or so breaths to get to your point of tightness. You inhale, rise. Exhale, maybe sink a little deeper. Just work your way into a place that works for you. Always thinking about pulling the heart forward. We have one more round of breath here. And then slowly just let your body ragdoll forward. And then we're going to roll up one vertebrae at a time, letting the head be the last thing that stacks on the shoulders. When you get there, just take a moment to feel your body and the sensations. Taking a breath. And from here, bring the soles of the feet to the earth. Scoot your hips forward to meet your heels. We're going to work on pelvic tilts. So pelvic tilts help to strengthen the low back. It's a very basic movement, but they're very important. So what you want to do is make sure if you reach down, you can kind of graze your heels with your fingertips. Then from there, take a finger, find your front of your pelvis, and you're going to take maybe a thumb or another finger and find the bottom of your rib cage. Press through your feet, but not so much you're lifting your bum off the earth. So we're just engaging by pressing through our feet. Now from here, we're going to take a big belly breath. Inhaling through the nose, belly expands. As you exhale, pull the navel down to the spine, and as you do, pull the hips toward the rib cage. So your bum lifts off the earth a little bit, but it's not because you're lifting it up, it's because you're pulling your hip toward your ribs. And then release that. You should feel your low back press into the earth. Let's do that again. Inhale, exhale. Hips come towards ribs. So you're imagining I have a string at your belly button. I'm pulling it straight down to the earth, and I'm pulling it so taut that when I pull it, the hips have to come to the rib cage because there's no slack in the rope. And then you're going to release that. So I want you to work through this at your own pace. You're going to inhale, exhale, navel to spine, hips come towards ribs, holding that deep core connection. So we're not actually working the abdominal wall, the rectus abdominis. We're working the deep core, transverse abdominis, the deep muscles of the pelvic floor, and release. You should feel like you're pulling up and in just like you did when we were standing. Big breath in. Exhale, let go. Navel to spine, hips pulled to rib cage, pressing that back into the earth. Everything should feel nice and tight. And then release. We're going to do that 2 more times. Inhale, exhale, pulling navel to spine, hips to ribs. The exhale is the most important part because it allows you to have space to engage deeply into the core and release. 1 more time just like that. Inhale, exhale, and release.
Now from here, we're gonna move into bridge pose. So what we're gonna do, if you moved your feet, go ahead and reach down. You should be able to graze your heels with your fingertips. Roll your shoulders under just a bit so the space between the shoulder blades is off the earth. Hands press palm down into the earth in an A position, or you can press your elbows lifting your hands if that works better for you. Take a breath in. As you exhale, press through your feet and lift your hips up off the earth. Squeezing the glutes, the hamstrings, the belly is nice and strong. Try to keep space in between your chest and your chin. So this is what it should feel like. We're gonna hold this for a couple more rounds of breath, and then we're gonna do a little bit of work here as well. Make sure everything feels nice and tight in the core. One more breath here. And then slowly release that. If you feel like you need to, pull that right knee into the chest. Maybe you extend that left leg long if that feels good to you. And then we're gonna switch out. Right foot goes to the floor, left leg pulls in. If you need a little bit more, that right leg extends out, just releasing the glutes and the hamstrings. And now bring both soles of the feet to the earth. Again, reach down, graze the heels. Shoulders rolled under, belly's nice and strong. Big breath in, press through your feet, lift up, hands in A or elbows in the earth. Now from here, belly is tight, nice and strong, and we're just gonna lower and lift for 10. So when you get to the top, I want you to squeeze glutes and hamstrings, belly stays strong. You don't have to go all the way down to the floor, but if that works for you, you can. I tend to hover just above the floor. Strong glutes equal strong back. So we got 5 more slow and controlled just like this. Again, my chin is out of my chest. My belly is nice and strong. So if you struggle with low back pain, the pelvic tilts is the exercise number 1 you want to try. Once you get strong with that, you can start to add these bridges in as well. One more bridge and we're gonna hold it at the top. Squeeze the glutes, belly strong. If you want a little bit more here through the chest, you can roll those shoulders under even more, interlace the fingers beneath you, press your fists toward your heels, breathe. One more breath. And then release your hands. Lower down 1 vertebrae at a time. Let your hips be the last thing that touch the earth. Untuck the shoulders, and then again, we're gonna hug that right knee into the chest. Maybe you extend that left leg long. You can give that ankle a little circle right, and then a rotation to the left. If you haven't extended that left leg long, go ahead and do it now. Release the bend of the knee just slightly. Take the left hand on the outside of the right knee. Right hand goes palm down into the earth, and slowly start to pull that right knee across the body, taking a little bit of a rotation through the ribs and the pelvis. Only go to the place that feels good to you. Try to keep that right shoulder and the right arm on the earth. It's okay if that right foot hovers above the earth. If you want to bend the knee and let it rest on the leg, you can do that. And then when you're ready, I want you to slowly release back to center. Bringing that right foot to the earth, then the left, because you're going to be on your left hip. Lift the hips, place them back down, hug that left knee into the chest. Whenever it feels good to you, you can extend that right leg long. Maybe make some rotations with that left ankle. Change the direction of the rotation. Release that knee just slightly so the knee is more in line with the hip. Right hand on the outside of the left leg, left hand goes palm down, and then slowly pull that knee across the body towards the right side of the mat, twisting between the ribs and the pelvis. And it's normal for one side to feel a little more tight than the other. That space between the ribs and the pelvis is where you should feel the twist. Staying connected to the breath, keeping that left shoulder on the earth. One more breath here. And then slowly release that left leg to the earth. Then the right, lift the hips, place the hips back down. Hug both knees in the chest now. You can place the hands underneath the knees or on top
of the shins, pulling the knees in towards the chest. Take a breath in, and as you exhale, pull your forehead up to your knees, round into a little ball, just to stretch across the entire spine. And then when you're ready, relax your shoulders down. Bring the soles of the feet to the earth. You can stay here if this serves you, or extend out into Shavasana or corpse pose. Wiggle around until you can allow your body to rest into the earth. Take a big breath in. Exhale, let it all go. And just start to connect to your natural breath. Allowing your head to be heavy, your shoulders, your arms, your back, your hips, your legs, your heels. Couple more rounds of breath here. And if you can stay here for about 10 minutes, I encourage you to do so. Just allowing your body to rest. If you need to follow me and end your practice, go ahead and wiggle your fingers and your toes. You can make circles with your wrists and ankles if that feels good to you. Extend your hands over your head, stretch from head to toe like you just woke up from a nap. And then roll to your right or left side, whichever feels better to your body today. And as you do this, take a transitional moment and just thank yourself for showing up onto your mat today. To love on your back, to loosen your hips. And when you're ready, press yourself up using your hands rather than lifting yourself up with your head or your neck, and find your way into a comfortable seated position. Kind of tilting that tailbone back, sitting up nice and tall. Hands palm up to receive, palms down to ground. And just take a moment to scan your body. Notice how your hips feel, maybe how your hips flexors feel, how your core feels, how your low back feels today after this practice. We're going to close our practice today using our breath. As you're ready, inhale, sweep the arms up, big breath in. Exhale your hands to your heart. This breath is for a strong body. Inhale, reach your hands to the sky, creating space. Exhale your hands to your heart. This breath is for a calm mind. Inhale, reaching the hands to the sky, creating space. Exhale your hands to your heart, breathing for a calm spirit. And one more breath, big breath in. Exhale your hands to your heart. This breath is from me to you, a breath of gratitude and thanks for joining me on Breathe Yoga and Wellness. Namaste.